So much has been talked about gut health. And how do you know you have good gut health, and what are the signs you have bad gut health?
That's another great question. So the looking at whether our guts are healthy is so very much important. It's probably the most important thing that we have control over in our bodies. And that is because the gut is not only where we assimilate our food, where we take in the nutrients of the food and process them so that they can be distributed to the rest of the body, but it's also where 2/3 of the immune system is. And so anything going on with your immune system, whether it's an infection, allergies, autoimmune disorders, even heart disease has been related to inflammation. Cancer is related to inflammation. So any kind of inflammatory problem, all of that has elements that happen in the gut. It's also the greatest producer of many of our neurotransmitters. And there is a strong gut-brain connection. So neurotransmitters, 90% of serotonin, for instance, is produced in the gut. Those things are influencing the brain, and of course the brain also tells the gut what to do, but it's really a feedback loop. And so we have the nervous system, the immune system, and all the basic nutrition, getting you the proteins and the fats and the energy. So it has to do with our energy. So all of those things are very much dependent upon gut health. So if you have any illnesses that are related to those issues, even if it's just fatigue, needing to nap frequently, or just not feeling like your brain comes online, your brain gets tired, those can be clues that you have something going on in your gut. So you don't have to have any gut symptoms to want to look in your gut. Anything going on in the brain, I am always looking at the gut first, and that includes mood disorders like depression and anxiety, concentration problems like ADD, as well as more serious brain problems like dementia, multiple sclerosis, Parkinson's disease. All of those actually have origins in what's going on in the gut. The gut also has a lot to do with detoxification, because our food, even if you are eating the best, perfect, organic vegetables that you grow locally yourself, there are parts of the food that was never intended to get into our bodies. So let's talk a little bit about how the gut works. And I'm going to mention a term called leaky gut. You'll see that a lot. So the gut is actually designed as a sieve, and it has the right size holes to allow in the right nutrients and keep the rest out, because even that perfect organic food has parts of it that we were never supposed to absorb. And many things can cause these holes to get large. Medications, illnesses, infections, toxins cause these holes to get large, and so now parts of the food that was never intended to get in can reach our bloodstream, and it can go everywhere from the hair to the toenails. And so that's where detoxification becomes very important. And we've talked a little bit in the past about leaky brain, because if you have leaky gut and these molecules are getting into your bloodstream, they can actually cause leaks in what's called the blood-brain barrier, which is a series of blood vessels and membranes around the nervous system, and that can really cause some serious brain and nervous system issues. So what are some signs other than these diseases that you might have leaky gut? Certainly any kind of digestive issues. You know, we have technical terms now. We talk about gastroesophageal reflux disease, or GERD. It used to be called indigestion. And so if you are having to take the little purple pill, that is very likely that you have a problem not digesting something properly. We do a lot to suppress acid, but the problem may actually be that you lack enough digestive enzymes. Particularly postmenopausal women often don't have enough digestive enzymes because the part of the brain that signals the pancreas to put out those digestive enzymes is very estrogen dependent. So as we have lower estrogen levels, we might not be putting out enough digestive enzymes. So this can actually cause too much acid, because if the body says, well, I don't have the enzymes that I need to digest these fats and proteins and carbohydrates, so I'm going to throw more acid at it in order to try to get it to break down. The funny thing there is that too little acid often has the same symptoms as too much acid. And almost all of us, as we age, particularly if you've had at least 65 birthdays, you may not be making enough stomach acid, but you go to the doctor and you talk about heartburn kinds of symptoms, and they put you on one of the proton pump inhibitors, or PPIs, or you go to the drugstore and you buy one of the over-the-counter ones, and it might relieve your symptoms, but it's actually causing the problem to get worse. And when we reduce the acid in our stomachs, we actually become more susceptible to infection, because no food is sterile. And that part of the reason for that acid in the stomach is to basically clean up the food and get rid of some of the microorganisms that get transported on it. And if that doesn't happen, then those microorganisms end up starting to populate the intestines. So this is a new term that you may have heard of more now, called SIBO, or small intestinal bacterial overgrowth, which is very much correlated with too much acid suppression or not making enough acid. And in this, we often get a lot of bloating. And that's because we're no longer really digesting the food. Again, if we don't have enough digestive enzymes, we're actually fermenting the food. And just like when you ferment beer, it creates a lot of bubbles. Well, you can create a lot of gas, and therefore you can feel like you're really pouching out a lot, or you end up burping a lot, or even passing a lot of gas, simply because you're fermenting your food. And this is often why people can't eat certain foods like beans, because they ferment them instead of actually digesting them. And so if you suspect that you have an issue like SIBO, you really do need to work with a functional medicine practitioner or an integrative medicine practitioner. This is often a very complicated thing in order to solve on your own. But one of the clues also there is not just a lot of gas, but smelly gas. If you have the kind of situation where you're clearing the room, then you are fermenting something and not digesting it. Often the two really big clues there are dairy products and grains such as corn, rice, and wheat. And so one of the things you can do to just see, does it make any difference, is try 30 days with no grains and no dairy products and see, do you notice an improvement in your digestion? If it does, great. If not, then you probably need to get some more help with that. The other thing that I consider an absolute emergency is constipation. People tend to ignore constipation. Maybe they've never had regular bowel movements in their lives. This is the sewer line and the most important way that we get rid of these wastes that we don't need and other kinds of toxins. As I tell patients, if your sewer line were backed up in your house, you would be calling the plumber immediately. You would not wait on this. And if you aren't going to the bathroom at least once a day, or it's not easy to go, and you're having rocks instead of snakes, so we want snakes at least once a day, and if you're having nothing or rocks, then this is something that we have to change right away. So those are some signs that something is going on in your gut.